My name is Susan Goodman. I'm an attending physician at Hospital for Special Surgery in the Division of Rheumatology. I treat patients with inflammatory arthritis, which covers a broad range of conditions. Our most commonly seen condition is rheumatoid arthritis, but also entities like psoriatic arthritis, ankylosing spondylitis, and other less common forms of inflammatory arthritis. I think the most important thing I do as a rheumatologist is make that differentiation, which is to determine if the process is inflammatory or if it's non-inflammatory. Although the non-inflammatory conditions may progress more slowly, we have really good treatments for the inflammatory conditions. So it's very important to me that we don't miss an inflammatory condition where we could make pretty meaningful interventions. I think it's very important in establishing a trusting relationship with patients to be very honest with them. And it's really very simple. I don't think a rheumatologist who wants to gain the trust of a patient over sometimes decades does that by making promises or overlooking potential toxicities. I think all of these decisions are something that you make with the patient. And I think that sort of approach inspires trust. Determining the right course of treatment for any given patient entails determining what that patient wants to get out of treatment. So every person has the things that they consider most important. You need to establish those goals and then work in the framework of what the patient tells you is most important. So our usual goal for treatment is remission. That's the ideal goal. If you have inflammatory arthritis, I'd like you to get to the point where you have no tender, swollen joints. However, if you're thinking about getting pregnant, if you're very concerned about infection risk, then we might make compromises in either the pace or the outcome. The treatments have been life-changing for the patients, and it's been incredibly rewarding and satisfying to see people with what used to be a really restricting disease now lead perfectly normal lives.